Welcome back, everyone, to Part 6 of our 15-part Interventional Radiology Coding Masterclass. I am super excited to have you here today. In our previous sessions, we've laid down all the essential groundwork. But today we are embarking on a top-down anatomical tour of arterial families. If you want to accurately code interventional radiology procedures, you simply must know your anatomy. We have to map the territory before we can navigate it.
Let's just jump right into this explainer. Look at the sheer complexity of our vascular system. It's basically this massive dynamic web of highways. The arterial family, which handles the blood supply coming from vessels like the aorta, is incredibly intricate. But for us as coders, it isn't just about knowing that blood is pumping, right? It's about recognizing these distinct specific families. Understanding these vascular families in interventional radiology is the absolute bedrock for everything we do when we're tracking a catheter's journey.
Here is our roadmap for today. We're organizing the major arterial families geographically, starting with the head and neck, moving down to the coronary and visceral arteries, hitting the lower extremity arteries, covering our core coding takeaway, and wrapping up with a summary and next steps.
All right, Section 1, the head and neck. Starting right inside the skull, we've got the intracranial arteries. The name kind of gives it away, doesn't it? These are the crucial vessels responsible for keeping your brain oxygenated and functioning. So when you're reading an operative report and the physician is navigating inside the skull, this is the exact vascular territory you were dealing with.
In those operative reports, you are going to see a few main branches pop up all the time. Specifically, the anterior cerebral artery, the middle cerebral artery, and the posterior cerebral artery. The second you spot these terms, you should immediately know the physician is working deep within that intracranial arterial family.
Moving just a bit down from the skull, we arrive at the neck. Enter the carotid arteries. These are the major paired transit routes, literally one on each side of your neck, pumping oxygen-rich blood straight up to the head and face. You can think of them as the primary interstates leading to the brain.
The key branches you'll run into here are the internal carotid artery and the external carotid artery. Telling these two apart is a super common, everyday task in interventional radiology coding, mostly because catheter placements here happen all the time for both diagnostic and therapeutic procedures.
Moving right along to Section 2, coronary and visceral arteries. Right in the center of the chest, we find the coronary arteries. Now, what's really wild about these vessels is their one highly specific job. Their sole critical purpose is delivering blood directly to the muscular walls of the heart itself. I mean, sure, the heart pumps blood for the whole body, but the coronary arteries, they are what actually keep the heart muscle alive and kicking.
A prime example of a target vessel you will constantly see in this family is the left anterior descending, or LAD, artery. It is a huge player in cardiovascular interventions, so definitely commit that acronym to memory if you haven't already. Dropping a bit further down into the abdomen, we hit the visceral arteries. The big takeaway here is that these blood vessels branch straight off the aorta to feed our major internal abdominal organs. So whether we're talking about the liver, the spleen, or the intestines, this visceral family is completely responsible for their blood supply.
The classic examples forming this family include the celiac arteries, the superior mesenteric artery, which you'll usually just see documented as the SMA, and the inferior mesenteric artery, or IMA. As an expert coder, the absolute second you read SMA or IMA in a procedure note, your brain needs to automatically file that procedure under the visceral arterial family.
All right, Section 3, lower extremity arteries.
As the aorta descends and eventually splits, we enter the territory of the lower extremity arteries. This is the vascular network that handles carrying blood all the way down through the pelvis, through the legs, and right down to the tips of your toes.
The crucial thing for us coders to recognize here is the chronological flow of these major highways. Usually, you'll see the iliac arteries branching off first, then moving down into the femoral arteries in the thigh, and continuing all the way into the tibial arteries in the lower leg. Tracking a catheter from, say, a femoral access point, up over the aortic bifurcation, and snaking down into the opposite superficial femoral or tibial artery, well, that is a classic coding scenario right there.
Which brings us perfectly to Section 4, the coding takeaway.
Think about it like this. When an interventional radiologist performs a procedure, they might place a catheter in the right femoral artery, advance it up into the abdominal aorta to snap some images, and then manipulate it back down into the left common iliac and all the way into the left superficial femoral artery. Mapping that literal, physical, step-by-step journey through those branching vessels, That is your absolute key to unlocking the correct code. You are literally tracing the doctor's footsteps.
So how does this build into our coding logic? Well, accurate coding demands a really methodical approach. Step 1, identify the arterial family. Step 2, pinpoint the precise target vessel bed. Why does this matter? Because this anatomical mapping is the entire foundation for selective catheter tracking. You simply can't code the journey or all the little first-order selections along the way if you don't actually know the map.
And finally, Section 5, Summary and Next Steps.
Now that you've totally mastered the geography of the intracranial, carotid, coronary, visceral, and lower extremity arterial beds, you are perfectly prepped for Part 7. In our next explainer, we're going to take this exact anatomy and finally crack the core code of selective versus non-selective catheterization. Trust me, it is going to change the way you read operative reports forever.
Before we go, I want you to ask yourself something. The next time you look at an operative report, are you just going to see a random list of vessels, or are you going to see the exact, step-by-step roadmap the physician actually traveled? Mastering these families truly changes everything. Thank you for watching, and keep learning with Decode Healthcare with Harshal.